My name is KK Holland.
And then, what do you think about healthcare reform?
Honestly, what's interesting about healthcare reform to me personally, being here at Netroots Nation, is the fact that we're talking about a lot of young activists, people who are working on a lot of times for nonprofits, they're working for small businesses. A lot of first-time authors are here and they're trying to do their own thing and really work on issues they care about. And because their health insurance is coupled to their corporate job, it's really difficult for young people, especially. We want them to have coverage, but we also want them to be able to go out and be entrepreneurial and start new enterprises and really go after what they feel their work should be. And so, I co-own a small business with my partner who's here, David Atkins, and it's something that we've struggled with, looking at having to be on individual insurance, which goes up a huge percentage every year. I look at what young people here at this conference are doing, and I really want to see healthcare coverage provided by the government option so that people can choose to divorce their healthcare from the advocacy and the jobs and the careers they want to have for themselves. So they have the freedom of choice.
Cool. And what has been your reaction to see some of the people at the town hall meetings?
I haven't really followed the town hall meetings very closely. I obviously have been hearing about what's happening with it, but I think when you talk about the pulse of what's happening with healthcare, people have their own personal stories. We can go to a meeting with elected officials and everyone can yell and rant, but the fact is, on the street, I have my own individual stories about healthcare. My neighbors, my mom, my friends have those stories. It doesn't really ring true to me that that's a real representation of where the American people are right now and where people are about that issue, because in our own lives we see firsthand what it's like when your sister loses health insurance and breaks her leg and it's $6,000 in the emergency room to get that fixed, when your boyfriend has a kidney stone and you're getting a bill for $18,000, when you talk to people who literally cannot afford to go to a doctor and get the preventative care that they need to manage things like diabetes or other problems. You can talk all you want about people coming out to these sessions and assaulting these legislators and yelling at them and causing these ruckuses, but it just doesn't ring true and resonate with what my experience has been, which is that healthcare really is a problem in this country.